Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there is one additional death related to COVID-19. I'd like to extend my condolences to their family, friends, and loved ones. The current 5-day test positivity rate is 12.1% provincially and 13.7% in Winnipeg. 303 new cases of the virus have been identified as of 9:30 a.m. Today, bringing our total lab-confirmed cases to 51,090. It is important to note that due to technical issues, today's count is believed to be an undercount of the actual case numbers today. We will anticipate a bit of an overcount then tomorrow as we reconcile those numbers, so we'll be updating as accordingly. Manitoba public health officials have recommended and enacted the current public health orders in order to protect the Manitobans and our healthcare system. Right now we're seeing too many Manitobans requiring hospital care and especially ICU care. We know that we have too many people in our ICUs in Manitoba and also in other provinces. We've seen too many deaths related to this virus. So again, we're messaging the Manitobans that we have the ability to continue to bring down the transmission of this virus. We have these orders in place for that purpose. Want to ensure we're staying at home as much as possible, reducing our contacts outside of home, and most importantly to get vaccinated. If you haven't been vaccinated as of yet, please book your appointment as soon as possible, and that includes as soon as you're eligible for your second dose. We know that a lot of what we've done has been difficult over these 15 months and counting, but bringing down our close contacts outside our households are the best way to reduce these transmission chains and bring down these numbers and again relieve that strain on the healthcare system. We know that all pandemics end, and this one will be no different. This time we have a vaccine helping us. And so continue to practice the fundamentals, get vaccinated as soon as possible, stay home as much as possible. Before I turn things over to Dr. Rymer, I want to take a moment to acknowledge the terrible situation in Kamloops and other residential schools across the country. While these conversations are important, they are difficult and may cause trauma or bring memories of past abuse. I want to encourage any residential school survivors or Indigenous people who need to reach out to do so, to reach out for help. You can call the First Nations and Inuit Hope for Wellness helpline at 1-855-242-3310. Counseling is available in English and French and on request in many Indigenous languages. The loss of hundreds of thousands of children at these sites is heartbreaking. This is one example among thousands of Canada's history of colonization and oppression. This terrible history is not staying in the past, though. It continues to affect Indigenous people today. We see poor health outcomes and health disparities in our Indigenous populations. The pandemic has only further highlighted this. We have a virus introduced into the world with universal susceptibility, but we again see disproportionate effects on Indigenous people here in Canada. We need to continue to work with our Indigenous partners and First Nation leadership and others to help reduce these health disparities moving forward. And public health certainly wants to be a partner in that moving forward. So thank you again to Manitobans. I'm going to turn things over to Dr. Rymer.
Thank you. Good afternoon. I'm Dr. Joss Reimer, Medical Lead for Manitoba's Vaccine Implementation Task Force. Before I begin, I want to apologize to the individuals this weekend who received an email from the task force that was an error but indicated that their appointments may have been canceled. The team has been working on some processes on how to handle canceled appointments, and due to human error, the message was actually sent out to about 15,000 people. A follow-up email was sent out to everyone on Saturday to correct the mistake. So we want to apologize for the confusion and, of course, following up to make sure that this doesn't happen again. As we have started to open up second dose appointments for people who had a first dose of either Moderna or Pfizer, I know that this has led to a lot of questions from people who received a first dose of AstraZeneca. These are good questions. These are important questions. And people want to know what vaccine they'll get and what else they may need to know about that vaccine. For quite a while at these press conferences, I've been saying that we were waiting for the results of a UK study that looked at second doses for people who received a first dose of AstraZeneca. This study was expected to be released by the end of May, but is still not out. And in fact, they've changed their estimated release date to late in June. We had been waiting because the data release timing was ideal for us to have the most updated scientific information prior to when the first recipients of AstraZeneca reached their 12-week mark. But late June is far too late for us to wait for. The good news is that a Spanish study has been released that showed that people who received a second dose of an mRNA vaccine after AstraZeneca had a good immune response. This is consistent with what we have seen in vaccines for other diseases as well. We've seen that changing products in between doses for almost every other vaccine still results in good effectiveness. And ultimately, that's what we're after: the effectiveness of the vaccine in preventing the spread and preventing the severity of a COVID infection. So what does all this mean for you? If you are someone who received a first dose of AstraZeneca, it means that we'll be recommending that your second dose be with an mRNA vaccine, either Pfizer or Moderna. It will be your turn when you meet provincial eligibility for second doses, like those who received Pfizer or Moderna. Alors, qu'est-ce que cela signifie pour vous si vous avez reçu le vaccin de Astra-Zeneca pour votre première dose? Cela signifie que vous recevrez un vaccin à ARN messager, soit Pfizer ou Moderna, pour votre deuxième dose. Vous devez attendre de répondre aux critères d'admissibilité établis par la province pour prendre rendez-vous pour votre deuxième dose. For most people, this will mean that you received your first dose of AstraZeneca on or before the April date, according to the provincial eligibility. There also is eligibility for those people who are Indigenous or have one of the health conditions that we announced related to second dose prioritization. So if you are Indigenous or have one of those health conditions, you are eligible for your mRNA vaccine a minimum of 28 days after your first dose of AstraZeneca. The 28 days is the minimum window between first and second dose, but based on the Spanish study, we are recommending spacing out those doses by 8 weeks if possible. The Spanish study gave Pfizer 8 to 12 weeks after AstraZeneca and saw the good immune response by doing so. I hope that this provides some clarity for people. I know that if you got AstraZeneca, the not knowing has been difficult and stressful. And at the risk of repeating myself from previous press conferences, this new approach in what we're doing for the second dose doesn't change that you're choosing AstraZeneca as the first vaccine that was available to you was and still is the right decision. Et à risque de me répéter, cette nouvelle approche que nous adoptons pour la deuxième dose ne change rien au fait que vous avez pris la bonne décision lorsque vous avez choisi de recevoir le premier vaccin que vous a été offert, qui était alors le vaccin de Astra-Zeneca. You were protected from COVID weeks earlier than you otherwise would have been. And in that time, you also protected the people around you. Some of the 75,000 Manitobans that received AstraZeneca have been exposed to COVID since receiving their dose. And because they were immunized, they were not infected. We know that these doses prevented people from ending up in the hospital. But now that we have more mRNA vaccines becoming available, and there's evidence to back up this approach, we can now make this adjustment. A second dose will provide you with even greater protection against COVID, without the extremely rare but serious risks that were associated with AstraZeneca. So if you are now eligible for a second dose, you can book now at any location that offers either Pfizer or Moderna. These mRNA vaccines are basically identical when it comes to how they work and their effectiveness, so you can book for whichever is most convenient to you. There are a number of pop-up clinics scheduled across the province in June, plus our super sites. If you're Indigenous, there are also 5 urban Indigenous locations where you can receive your vaccine. We will also be sending doses of mRNA to clinics and pharmacies in June. I do want to be clear that this approach will not have any effect on when we expect to be able to complete second doses for all Manitobans. Because people who received a first dose of AstraZeneca is a relatively small group compared to all Manitobans, we are still on track to deliver all second doses to people by the end of July. There are still a small number of AstraZeneca doses, about 3,700 of them, with medical clinics and pharmacies throughout the province. All provinces received word from Health Canada that based on their review of stability data that was submitted from AstraZeneca, doses that were originally set to expire today can now be used until July 1st. These doses are going to remain with our partners in case there are people who are unable, for whatever reason, to receive an mRNA vaccine. And the evidence is showing us that the risk of the rare but serious side effects of blood clots with low platelets is even more rare after the second dose. For people who received AstraZeneca, a second dose of AstraZeneca is still better than no second dose at all. And I want to be clear on this point. Our advice on AstraZeneca remains the same. The risk of blood clots with low platelets is very low. When mRNA is not or was not an option for whatever reason, there's still a very clear benefit to receiving AstraZeneca for dose 1 or dose 2, as opposed to not being immunized. This move to mRNA for dose 2 for most people is because we now have a robust supply of mRNA available to Manitobans. And so while the risk is very low, we want to move to something that's even lower risk. To wrap up, I want to thank everyone who heard that we were opening the Leela Super Site to walk-ins and added that to their plans. On Thursday and Friday, more than 2,600 people came to that site as walk-ins for either their first or second dose of Moderna, and that was great to see. I know that the task force is reviewing what went well, where we can improve, and whether we can make walk-in immunizations more available in the future. So we'll share updates from that as soon as possible. Every immunization is a reason to celebrate. So I also want to thank our friends from the Blue Bombers and Valor FC who came to say hello to people at Leela and at RBC on Friday and Saturday. To Buzz, Boomer, and Vic, thanks for being a part of it all. I'm only a little bit jealous that you left before I was there to receive my own second dose at RBC this weekend. So with that, we will go to questions.
Thank you, doctors. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CJOB, Skylar.
Hi, you two. Thanks for your time this afternoon. Dr. Rymer, there have been obviously so many questions for AstraZeneca recipients. I'll try to make this as simple as possible. Is a second dose of an mRNA vaccine as good or more effective than receiving a second dose of the AstraZeneca vaccine if it was available?
So we have data from the Spanish study, the CombiVax study, that showed us that people got a strong immune response if they received Pfizer 8 to 12 weeks after AstraZeneca. We also have evidence from animal studies that showed that it was equally or even better as far as the immune response when switching products. And then we also have data from many other multi-dose vaccines that show us that switching products very rarely has anything but a neutral or positive effect. So it would have been ideal to also have the UK study results before making this decision, but that's the nature of a pandemic. The science is changing all the time, and we have to make decisions in the best way that we can with the information that's available to us.
Thank you for that. Dr. Roussin, I would assume this one is for you. Have you had any conversations with the National Hockey League about a potential opponent for the Winnipeg Jets in the third round coming to the city to play hockey? And if so, how far along are those conversations?
So we've reviewed the plans at a high level on that, so we don't have anything specific to comment on at this point. What we would know is that there would be, the safety of the public is our first priority. So we'll ensure that any such travel would be done in a very safe manner.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Dr. Rymer, can you, you talked about a recommended interval and a minimum interval per second. What is, I mean, obviously that is, but for people who want, maybe that vaccine earlier, are they going to be allowed to book that, or are they going to be told no on the phone or online if they, should they wait 8 weeks or can they do it the other way?
So the strict eligibility that the call center and the online system will be using is a minimum of 28 days because that's the manufacturer's minimum for Moderna and for AstraZeneca. Our recommendation is that. We have seen good evidence that a dose of an mRNA 8 to 12 weeks after AstraZeneca creates a strong immune response. We don't have a study looking at before 8 weeks for those specific vaccines, but I think that there is growing evidence that the manufacturer's minimums are likely not the ideal interval and that you do get a stronger immune response by getting that second dose longer than 3 to 4 weeks as per the manufacturer's minimum. And so we want to encourage people where possible who have received AstraZeneca to follow the best science that we have right now, showing us that a good immune response comes in a dose that is given 8 weeks after the first dose. But we know that there are some people who, because of their health status or because of their job, are at either very high risk of being infected or high risk of having severe outcomes, where that second dose and the boost from that second dose, even if their final immune response is lower than if they had waited, getting that earlier boost can still be really beneficial while we're in this third wave. So the official minimum is 28 days, but for anyone who is relatively healthy and able to practice those fundamentals to avoid being infected, we recommend that they wait 8 weeks after their AstraZeneca before receiving an mRNA vaccine.
All right, thank you for that. Dr. Roussin, question regarding the public health orders now regarding working from home. A lot of teachers are still being forced to work in school classrooms, even though they're working remotely. What is the guidance or the message for school divisions in this province that are shuttered right now when it comes to teachers? Should teachers be allowed to work from home instead of having to go into school every day to teach from there?
Well, the overall message is that people who can work from home. We require that in the public health orders. For these specific things, I would turn it to education on balancing the the need for it and balancing the safety precautions that are in place. Like we've mentioned many times here, our colleagues in education have done a tremendous job at making those schools safe for staff and students, and so we're still relying on them to do the same.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin. Hello, Dr. Rymer. My first question, I guess it's for Dr. Rymer. The Spanish study that you mentioned just mixed AstraZeneca and Pfizer. So just for us and for people to understand, why is it safe to have a second dose of Moderna also in this case?
Pfizer and Moderna work in the same way as far as how they trigger an immune response. Essentially, they're two different brands of the same vaccine. So they're both using mRNA. Both of them are in a lipid nanoparticle or a very tiny globule of fat that holds the mRNA. They both teach the cell to produce spike proteins that are the proteins on a virus that our body responds to. So we expect that whether you got Moderna or Pfizer after AstraZeneca, you would get an equivalent immune response. And we encourage people to get their second dose at whatever location is most convenient to them. We want people to get those second doses as soon as they hit that 8-week mark, and don't want them to worry about vaccine shopping while they're trying to book that appointment.
Thank you very much. And I have a second question about vaccinations. If I have already been infected with COVID-19, should I receive the second dose of COVID-19 vaccine or not? For example, in Quebec, it's possible to don't have a second dose of vaccine. Is it something that you consider in the future?
Yeah, this is something that there's a few different approaches that different jurisdictions are taking. There does appear to be some growing evidence that for people who have been infected in the past, that the first dose can function more like a booster or more like a second dose for people. But right now, we're so early in that evidence that we're still asking all Manitobans to get 2 doses because we'd rather be sure that people are protected than take a chance at the long-term protection that you get from an infection plus a dose. But certainly as the science evolves, if it becomes clear that there's good immunity, this is something that we can take away and change our approach if we need to. As a proportion of all of Manitoba, this is a thankfully small group. And so it also, from a logistics standpoint, is much easier for us to have a consistent approach for everyone. But like I said, as the science evolves, we will look at it and bring it back to Manitobans if anything changes.
Thank you.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. On Friday, Dr. Atwal says it's essentially going to be up to employers voluntarily to follow this public health order to allow people to work from home when possible. I've already heard from people who said that their employers are saying, nope, you're an essential worker, you got to come in, even if it's a white-collar job in an office with a laptop. What methods is public health and enforcement going to take to actually allow these folks to work from home?
Yeah, I think it's, we put that in the orders this time because we expect it to be followed. We're in a third wave right now. We have Manitobans receiving critical care in other provinces because their ICUs are full. So we're going to rely on Manitobans to do whatever they can to lower the risk for Manitobans. And one such way is, if you can, then work from home. And so, I think the test for that is challenging on what makes someone definitely able to work from home, but we're calling on all employers. If you have people at your workplace who can do their job from home, we expect you to make arrangements for that. We're at a critical stage here. So as far as enforcement, I think, again, this is not, public health's purview necessarily. I think it's challenging for sure. But we're relying on Manitobans like we always have.
Similarly, when I look at the form that employers are to fill out when they're assessing the COVID risk in their workplaces, and that's a form that's on a publicly accessible website. The onus is on the employers to be honest there. Now, if I'm running a business and my profit margins are depending on my shop running, as optimally as it can, meaning with as many people as it can, for some there may not be a lot of incentive to answer that form truthfully. So what kind of conversations is public health having with workplace health and safety to ensure that employers in these settings, especially ones with production lines, are actually truthfully filling out those forms?
Yeah, and so we've, right from the beginning of the pandemic, worked with employers, worked with workplace safety and health, with the chief occupational medical officer to set out guidelines for workplaces to help assess the risk, to help reduce the risk in many instances. We investigate cases and contacts within workplaces and try to remediate any issues with that. So there's a lot of stakeholders in play, and yes, we work quite a bit with the workplace safety and health who do assess these risks over time. So again, with a lot of these orders, we definitely rely on Manitobans, and we can see that most Manitobans have stepped up and trying to bring down that risk for everyone.
From the Canadian Press, Kelly.
Hi. So I'm just looking at the news release now, but there's 71 intensive care patients in Manitoba. How many are out of the province now, and where are they?
There are, I believe, 36 that are receiving care outside the province, 35 in Ontario, and 1 in Saskatchewan.
And this is probably for Dr. Rymer, but when it comes to mixing the second doses for those who got AstraZeneca initially, and apologies for me not being quite up to date on the national profile of this decision, but have other provinces announced that they're doing this yet? And, a lot of times we've watched what's happened in other provinces before making decisions ourselves. Why kind of take the lead on this vaccine decision now?
So we're not the first province. Quebec had already announced that people would be able to receive an mRNA after an AstraZeneca dose. But I think it's less about which province takes the lead and more that, we had a chance with our clinical team to review all of the data. We received notification that the UK study would not be available in time to inform our decision. And we saw that Manitobans were feeling really anxious about this information. And so it made sense for us to make a decision and tell it to Manitobans as soon as we knew what direction we wanted to go, regardless of what other jurisdictions would do. We've seen as well, many countries in Europe have taken a similar approach. Germany, France, Sweden, several other of the Nordic countries, Spain, have all been offering mRNA after AstraZeneca doses. So we're certainly not alone. But the most important message would be that for Manitobans, when our clinical team reviewed every piece of information that we had available to us, we wanted to share that with the province as quickly as we could.
From CTV Winnipeg, Michelle.
Hi, Dr. Rymer. Are you looking at also mixing first doses of Moderna and Pfizer with second doses, so doing a different one for the second dose there? And what happens to the other AstraZeneca doses that Manitoba may get in the future? Are we still going to accept those shipments?
So we are hopeful that the UK study will show us some clear data around switching between Moderna and Pfizer. But I would say even today, if we had a shortage in one or the other of those products, we would be comfortable, our clinical team would be comfortable recommending that someone receive the other mRNA vaccine rather than not being immunized with their second dose. So that's already in place, that we can switch between those products if the same product is not available. And that's consistent with NACI as well. They've indicated that, wherever possible to stick with the same product, but that it is an option to exchange within the same type of vaccine if that first product is not available.
Okay. I also asked about what happens to AstraZeneca, but doses coming forward. But I have another question for Dr. Roussin. What is the threshold between going from a fine to an arrest warrant for someone who's breaking public health orders? And why are some gatherings still taking place when there are numerous warnings not to do so? An example would be like a church service.
Yeah, and so, our enforcement bulletin comes out on Tuesday, questions, specifics on escalation of fines or arrest warrants really isn't for public health. We'll have to direct that to our enforcement table. And, where our, public health has these orders in for a purpose. That's to protect Manitobans. We expect Manitobans to follow those orders, which we see for the most part. But we do see some of these gatherings, and enforcement becomes necessary at those points. But details on that will be in the enforcement update.
From City News, Mark.
Hi there. My question would be, we know the Army or the Canadian Forces arrived on Friday, and they were setting up and doing training over the weekend. It was also a weekend where we saw the single highest COVID admissions to our ICU. How optimistic are you that the military now being here is going to turn this COVID situation around in the province?
Well, there's a number of issues there. Is that we're dealing with a lot of case numbers right now, and so high case numbers put strain on the healthcare system. And so first and foremost, we need to bring down these numbers. And so we're going to be watching those closely. We, expect those to come down, and thus less strain on the healthcare system. Of course, that's a lagging indicator. If we see these case counts coming down, we're still going to see strains on the healthcare system for the following week or two. But right now we're focused on bringing down these numbers in public health.
Thank you. In 4 weeks, when we revisit looking at scaling up or scaling this down, what benchmarks would you be looking at to make that decision either direction? Is it % of the population vaccinated? Is it ICU numbers? Is it amount of people still going out of province? What would be a good measure for you to make that decision?
Yeah, and so from the public health view, then, of course, the indicators that we've used in the past, test positivity, absolute cases, now add to that % vaccinated, possibly first dose and second dose, looking at that through each of the age cohorts. So those are certainly indicators that we'll be following. But then, of course, we have to see the state of our healthcare system. So the rate of admissions, our ICU rates, how we are coping in that healthcare system. So we're going to have to take that all in consideration. So again, it's not going to be one or two indicators. It's going to be the overall trends, considering the case numbers, but a large part of that's going to be the state of our healthcare system.
From the Winnipeg Free Press, Danielle.
Good afternoon, Dr. Rymer. My first question is for you. We have heard that bookings for first doses of the vaccine are slowing. So what is going to be done in the immediate term to get more people vaccinated in neighborhoods and regions where uptake is dropping off and to get past 70% uptake?
Well, we need to do several different things because we need to address several different reasons why people may not be getting their first dose. So some of the work that's going to take longer and more effort is around those people who have questions about the vaccine or don't feel confident in it as a way to protect themselves. And so that work is ongoing, where we're meeting with local leaders, whether it's municipal or religious leaders or other community leaders, to help connect with them and give them the answers that they need to take back to their community, because we know that they're trusted voices in their community. So that work is happening actively to help improve uptake in places where it's questions about the vaccine that are leading to the lower uptake. But for many other people, particularly in Winnipeg, the uptake is lower in areas where people experience a lot of barriers to healthcare more generally. And so we are working with some community organizations and some of our community clinics to move vaccine into more locations that are more comfortable and more convenient for people to go to. So we'll be having vaccines being provided through some of the well-known community clinics in Winnipeg. We'll also be in June moving mRNA vaccines more broadly around the province into pharmacies and clinics. And then also working with community organizations to identify some ideal pop-up locations throughout the province that can make people feel safe and can reduce a variety of barriers that people may face, such as the time it takes to get to certain locations, such as childcare, as well as the comfort with the space itself. So we'll be continuing to announce these new locations as we move forward. This is not something that we will do and then complete our plan and be done with the plan. This is an approach where we intend to continually improve and extend the reach of the vaccine to people who may not otherwise be immunized.
Thank you for that. And Dr. Roussin, as of Saturday, more than 100,000 people have been fully vaccinated and more than 600,000 partially immunized. Will the province change its next set of public health orders to recognize the immunization status of vaccinated Manitobans?
Yeah, so I mean, this is something that's definitely being considered. We want to find ways to show the immediate benefits of being vaccinated. We know those benefits are, protecting ourselves, protecting the people around us, but we also want to be able to, further encourage vaccine uptake by showing some immediate benefits to it. There's, some challenges with that. Of course, a lot of the gathering limits that we have, are difficult to enforce. And if we open it up to vaccinate people, it becomes even more difficult to deal with the amount of gathering that would occur. So we're going to take a cautious approach to that. But most definitely, vaccines, are our way through these restrictions. And the more Manitobans that get vaccinated, they're receiving benefit immediately by protecting themselves and the people around them. But they're also going to be receiving that benefit that the further we get along with these vaccine uptake, the sooner we can start easing these restrictions.
From Global News, Anya.
Good afternoon to you both. Dr. Rymer, my first question is for you about the Astra-Zeneca expiry date being extended. I'm just wondering if you can explain to people what it means to extend an expiry date. Obviously, when we think of that, we think of something that is no longer good. Can you explain how often this happens with perhaps other shots like the flu shot and we just don't know about it?
Well, I don't have numbers on how often it happens, but what I can say is that AstraZeneca applied to Health Canada and requested the extension, and they submitted stability data to Health Canada, demonstrating that the product maintained all of the same characteristics as expected for a longer period of time than the original date that they had put on the product. So this wasn't an assumption that Health Canada made. It really was a decision that they made based on data that was given to them by AstraZeneca, demonstrating that the product remained in its ideal condition for a longer period of time.
Okay, great, thanks. And Dr. Roussin, my next question is likely for you. Toronto is allowing several hundred fully vaccinated healthcare workers to attend tonight's NHL game, and Montreal allowed a few thousand members of the public into their game on the other weekend. Is the province considering something like this for the Jets' home games in the second round?
We don't have anything for certain at this point. Our trajectory is certainly different at this point than what those locations are on. So we're going to have to look at our local epidemiology and make a decision based on that.
From the Brandon Sun, Kimberly.
Good afternoon, Dr. Roussin. My question is for you. What is a clear definition of no transmissions in the workplace if you aren't counting cases occurring, say, in the lunchroom of a workplace, based on what Dr. Atwell said last Friday?
Yeah, it depends. So investigating disease clusters is what public health does all the time. So this is not new to be investigating clusters of illness and finding transmission chains and then implementing measures. So this is a process that we have for many other illnesses. So when you look at a workplace, we try to find out whether there was transmission or clear transmission within that workplace. We work with that workplace to try to remediate things, even if we don't necessarily find transmission. There's always things that can be improved upon, and we're able to do that with most workplaces. I think if we find evidence of ongoing transmission within a workplace, that's where we have that. Always have had that option to close that workplace for a defined period of time to complete the investigation, to stop the transmission chain there. So it really depends on the specifics, but this is really what the public health team does all the time.
Thank you. I have no further questions.
Our final reporter this afternoon from CTV National News, Jill.
Good afternoon. Dr. Rymer, we're seeing Southern Health is now consistently reporting, the second highest number of infections, of course, well below Winnipeg region, but still second highest infections in the province now. How's that translating into hospitalizations and ICU capacity?
Go let Dr. Roussin take that question.
Yeah, and so again, these are the hospitalization and ICU are typically lagging indicators, so we see that follow the higher climbing cases. So I don't have any of those specific numbers in front of me, but what we know is a certain proportion of test positives will end up being in hospital, and a certain proportion of those will need ICU. So the higher the numbers in any region or any health sector is going to eventually lead to increasing demands on the healthcare system.
Dr. Reimer, apologies. This question is for you. AstraZeneca appears to be vaccine non grata in this province now. We saw big lineups outside pharmacies this weekend of people getting second doses. What are we telling the feds now? Are we saying we just don't want the vaccine in this province anymore?
Well, we still are using AstraZeneca for people who wouldn't otherwise be able to receive a first or a second dose for whatever reason that may be, whether it be an allergy or discomfort with the mRNA or access to a site. So we do still want to have some AstraZeneca available in the province for people to make sure that we have the best options available to every Manitoban, regardless of their personal circumstances or where they live or their health status. So, it's been a challenge to communicate with Manitobans about AstraZeneca because of all of the new information that we've gotten throughout this pandemic on AstraZeneca. But we do want to reiterate to Manitobans that protecting yourself and protecting your families and your community was the right decision. That even though we're changing now and recommending mRNA for most people, that AstraZeneca served a critical role in this rollout in preventing deaths, in preventing hospitalization. Many of the people who received AstraZeneca would have been exposed at some point in the last few months to COVID in the community, in their households, in their workplaces, in gatherings, and we know that AstraZeneca helped reduce infections. We know that it worked to prevent people from ending up in the hospital. So our plan going forward with the information we have today is to focus mostly on mRNA, but still keeping AstraZeneca available for those people who wouldn't be able to receive an mRNA.
Thanks, everyone. This concludes our media briefing.